Good evening, and thank you for joining Congresswoman Haley Stevens' telephone town hall event this evening. We'll be hearing from Congresswoman Stevens shortly, but first, I'd like to let everyone know that you can ask a question during this call by simply pressing *3 on your telephone keypad. That's *3 to ask a question at any point during this event. Now, this call is also being streamed live on the Congresswoman's website at stevens.house.gov/live. Also, if you would like to subscribe to Congresswoman Stevens' e-newsletter to receive updates on the coronavirus and other important issues, please dial *6, and our staff will help sign you up to receive updates from our office. Now, without further ado, I'd like to introduce your Congresswoman from Michigan's 11th Congressional District. Here's Haley Stevens.
Thank you so much, and good evening to everyone who has joined. I want to encourage any of you who have a question on this call to press 3, and we will do our best. It's a *3. You have to push *3, and we will do our best to have it answered. I understand that this is an unprecedented and trying moment in our country, in our region, in our state, and in our district. Our priorities are the health of everyone as well as the financial security of everyone. And my plan is for this evening is, as it's always been at all of our town halls, to listen, learn, and engage with all of you so that we can lead in Washington and to deliver the best results and responses for each and every one of you. I understand there's a tremendous amount of uncertainty and a different type of news that is hitting your headlines. And in fact, we normally like to be in person, but these times call for us to be doing this through telephone. And we've done several telephone town halls. Something unique for tonight's town hall is that we are joined by several experts from our community that will also help to answer some of the technical questions that some of you might have. We are fortunate to have with us this evening Leanne Stafford, who serves as the health officer for Oakland County's Health Division. She is a public health expert and will be able to discuss local initiatives in our region that have been put into place to respond to and prevent the further spread of the coronavirus, COVID-19. That is what we are talking about this evening, the COVID-19's existence as well as the efforts to stop its spread and to keep everyone in our community healthy. Again, it's *3 if you would like to ask a question. I am now going to turn it over to Leanne Stafford to introduce herself.
Good evening. As the representative indicated, my name is Leanne Stafford, and I am the health officer for the Oakland County Health Division. And just to tell you a little bit about what is going on in Oakland County, we currently have 17 confirmed cases in Oakland County. And actually, there's 65 that the state of Michigan have actually confirmed per their website. And, our big focus to this point has really been trying to get education materials to the community and keep that information updated so that residents had an opportunity to see what's new. We really tried to focus on the different sectors that maybe were affected. So we looked at businesses, we looked at general, and so what we did is we looked across the county and said, okay, what areas do we need to focus on to maybe provide cleaning strategies for the different sectors, things to think about, in these times about, separation between people. And so that we developed those toolkits and roll those out on our website and, continuously provide new information up on our website. But another big piece of our response has been the monitoring in the community. So as part of our agency, we have what's called epidemiologists that look at, what up to this point has been, cases, people that have had exposures maybe to a positive case, maybe contacts to a positive case, and monitoring them. And what that meant was staying in contact with them, sometimes twice a day to see if any of their health effects had changed. So if they were feeling zero symptoms when we first contacted them, does that continue? And we actually follow them through 14 days. We did a lot of that at the very beginning with some of the cruises, some of the travel advisories that came out, and so we continue to do that. But in addition to that, when we do have a positive case, we do case contacts. So we look at what that person has done over the last, it could be last 14 days, from the time that we actually received that positive result to 14 days out, and from when they started seeing symptoms moving forward. So if someone was in the community or they were at a restaurant or, whatever their movement was through the community, we record that and look at maybe who else could have been exposed. And those individuals would be go in self-isolation, and then we would also monitor them. So it's kind of that circle of continuing to monitor. And so, those have been three of our big efforts since this has begun. There's lots more that we've been doing, but really trying to stay ahead and educate and provide as much information as possible.
And thank you so much, Leanne. And for those of you who've just dialed in or just joined our Tele-Town Hall tonight on the coronavirus epidemic and the efforts to stop its spread and secure the health of all Americans, I believe it's important for us to lend a definition to what is the coronavirus disease of 2019, which is known as COVID-19. And Leanne, I know your offices are operating under this definition. And just for everyone on the call, COVID-19 is caused by a new respiratory virus. This is a new disease of which some of its elements are mysterious. We know that for some people, they maintain mild symptoms. Some people, they get heavier symptoms, and for a smaller segment, but a segment that we are trying to prevent from growing is severe and severe instances of this virus, which leads to respiratory issues. So in December of 2019, the virus had begun circulating in humans. And this is a health concern. It is something that health experts have expressed concern around, given how little is known about this virus and the potential that it causes to severe illness and eventual pneumonia. So we are also focused on this call with, and lucky to have Dr. Dwayne Newton, who is the director of the Michigan Medicine Clinical Microbiology Laboratory. And Dr. Newton is an expert on testing, and he is going to be able to offer his expertise to help answer any questions that we may have in this capacity. And Dr. Newton, I'm just going to give you a few minutes to also introduce yourself to everybody on this call.
Thank you, Congresswoman Stevens. I really appreciate the opportunity to participate in this important discussion. As you mentioned, I'm the director of the Clinical Micro Lab at Michigan Medicine, and our lab, the role that our lab plays in healthcare is in receiving specimens from patients whose physicians think they have an infection. And our lab, the people that work in my lab, are responsible to try and figure out what type of infection that might be, and whether it's a strep throat infection or a respiratory virus infection. And one of the challenges for us during this outbreak is the fact that this is a brand new virus. This is not a virus that we've ever seen before. There are many types of coronaviruses, like the novel coronaviruses that causes COVID-19, but this was a brand new one, and we didn't have diagnostic tests for it. We actually, when the disease first started circulating, people didn't know what was causing it because there was no test for it. And it took several weeks, if not months, to figure that out and to really be able to identify specifically what the virus was. And that presented a lot of challenges. It has presented a lot of challenges for physicians and for laboratorians in trying to make the diagnosis, because it was a new virus and we didn't have a test for it. And it's taken a while for those tests to become available, more widely available, so that that diagnosis could be made more quickly. And one of the roles that we have been playing in this mission is trying to develop a test that we could ramp up and make available for physicians in our health system to be able to use to detect people who are infected with this virus.
Well, thank you so much, Dr. Newton and Leanne, for joining us this evening and being a part of the Tele-Town Hall on behalf of Michigan's 11th District. I want to let you all know that if this call runs past 7, and that goes for all of our phenomenal constituents who are on the phone, I'm going to let you two get off the line because you have really important jobs and important work to do, and I will remain on the line and continue to take incoming questions from constituents who might have them, because I know for all of you on the phone this evening, I am sure you have a lot of questions, and I am here to address that. We are all here to address your questions and help get you what you need. Specifically, I also want to share with all of you that if you or a loved one are having a specific health question, the Michigan Department of Health and Human Services has stood up a hotline that will be open 7 days a week from 8 a.m. to 5 p.m. There, on that hotline, public health and other experts will be able to answer health-related questions about COVID-19. They can also direct residents and providers to the right resources in their local communities and in other state government departments. So I'm going to give you all who are listening in the number for the Michigan Department of Health and Human Services hotline that has been recently stood up. That number is 1-888-535-6136. In addition, my office, your congressional office, is also here to continue to help you address and access federal resources and needs, or connect you with state, local, or community resources on a range of issues or questions that you might have, including related to COVID-19. I will, at this time, again, remind everybody to dial *3 on your touch phone now if you would like to ask a question. This crisis that we are all going through requires and has required a coordinated, comprehensive, and fully funded response from the federal government. It has also required vast state action, as you have been experiencing and seeing the executive orders coming from Governor Whitmer. I want to let you all know the work that I have been doing as your member of Congress on most recently, in a bipartisan way, the Congress passed a $8.3 billion immediate emergency funding package for local healthcare providers. This is some of what Dr. Newton was just discussing around getting access to tests and development for vaccines. So this package was an effort to combat this pandemic. Yesterday, Michigan began receiving over $14.5 million of this funding to support our providers, our phenomenal healthcare professionals who are on the front lines for us in our community. If you see a healthcare professional, thank them. These are just incredible individuals. And this $14.5 million has also been used for case identification for that testing and the purchasing of additional equipment and supplies, among other important functions. The new law also includes the creation of an additional emergency disaster relief small business loan program. Michigan is in the final stages of qualifying our application, which will award small businesses up to $2 million for loan assistance. This is certainly a start to help our small businesses who are being impacted by the efforts to contain COVID-19. I have been working very closely with the governor's office as well as the Small Business Administration to ensure that our small businesses in southeastern Michigan and across our state can quickly become qualified to apply for these loans. I know many of us are seeing, in some pockets, are seeing job loss and loss of wages, and we are continuing to work on efforts to address those matters in the Congress as well. But testing has remained our imperative. And thank you again to Dr. Newton for your great explanation of where we are on testing. Lastly, over the weekend, I was proud to support another bipartisan House package that ensures that tens of millions of working families have paid sick time off from work to tend to their health and to prevent the spread of coronavirus. This is still expected to be passed into law this week. It passed the House. We are projecting to see it pass the Senate. It's obviously Tuesday, and the Senate came back into session this week to work on this exact piece of legislation that will also encourage the funding of more resources for testing. I am continuing as your member of Congress to engage with my colleagues and leadership in the House of Representatives and in the White House to push for a swift package of a third coronavirus response package, an economic or financial triage that will ensure that the ricochets into our economy don't lead to a sustained recession or wide job loss or closure of the small businesses or the contract work that we provide. So to be clear with everyone on this phone, this is part of why we are holding this town hall, to hear from you about your concerns, your health concerns, your financial concerns. Your health is most important. It is the paramount consideration, and that is why our governor and our country is taking such swift action to secure the health of every American in this country. And in addition, we also have to secure the financial health of every American and every Michigander. That is certainly something that is on my mind, and I want to make sure everybody knows who wants to maybe push that *3 that There are no dumb questions. There are all statements and stories and narratives are welcome here. I am encouraging you to share those, particularly as we are crafting responses and triaging this current situation. The time to act is now. The time to act quickly and responsibly is upon us, and I have full faith in our federal, state, and local leaders to come together to contain this virus. And I certainly maintain my commitment to every single one of you to be an open line and of assistance to you at any time you should need to carry us through this unprecedented moment in modern human history. So, with all that, thank you all for being on this call. We are going to take your questions at this time. Again, it's *3, and we will begin with the first set of questions.
Thank you very much, Congresswoman. So again, if you have a question during this live telephone town hall, by pressing *3, you'll be placed in the queue to ask your question live during the call. This call is also being streamed live at stevens.house.gov/live, and there you can also ask a question. And our first question does come from the web. We've got Beth asking, Beth, will small businesses receive support to stay in business? It's a great question. Congresswoman, your answer.
Yeah, absolutely. And thank you, Beth, so much for chiming in. And we're fine to have people also who just want to talk on this Tele-Town hall to ask their questions as well, verbally. We don't have to have them all filtered. I don't know if that's something that we had set up, but I want to hear your actual voices on this call. So that said, Beth, in terms of the small businesses and the assistance that we are looking to provide to all of you, what we're dealing with here in terms of the closure of restaurants and the need for social distancing, that obviously hasn't been mentioned at this point on this call, but we are social distancing as a state and as a region right now, and so that has changed the nature of how we do business, and that is why the governor had to put into place a cessation of restaurant and bar activity under 10 people, encouraging people to do carry out or delivery. But it's not just our restaurants and our bars. It's hair salons, it's beauty salons, it's contractors, it's people in the entertainment industry. There are a lot of questions being raised, and certainly I know many of you know how much I care about and how close I am to our manufacturing sector as well, and some of the challenges that social distancing create on production lines. So we have a start here, Beth, with the disaster emergency declaration for small businesses. I have called the Small Business Administration myself. They have told me that they are open 7 days a week and going to help the small businesses of this country carry through this time. What will soon be made available, and I think just a matter of days, will be loans. You can start working on your application now, but loans up to $2 million to float your business through this time period. I will be honest with all of you. I believe that program is a great first step, and I'm very encouraging of it and excited to offer it. But I know that it, as a former White House appointee in the United States Department of Treasury during the last Great Recession, we are going to need to go wide here, and we're going to need to act immediately. And there are a lot of policy options on the table right now that are influencing and will become a part of a third legislative package for economic triage. I want to make clear to every single person on this phone call. Your health is our top priority. The security of your health is our top priority, and your financial security is our top priority. And I'm going to let you all know that we are not going to let you fail. We're not going to let your financial situation fail as a result of this pandemic. We will help you as individuals, we will help you as small business owners, and we will carry our country through this great period of uncertainty to another side that will be more prosperous and secure than we were before COVID-19 hit our shores. Thank you.
Thank you, Congresswoman. Going now live to South Lyon, we've got Elizabeth on the line talking about symptoms. Elizabeth, go ahead with your question, please.
Hello.
Hi, Elizabeth. Hi.
Hi. My question was for a strong, healthy young person that may have seen signs of illness, how long after they've had symptoms are they no longer contagious? Because they talk about, what to look for, but what happens after maybe you think you've had it? How long before you should go around people again? How long does it take?
Thank you, Elizabeth. Thank you. Great question, particularly because we're hearing that young people are slightly, less symptomatic and less affected, although I would like to stress that anybody can be affected and infected by COVID-19 and fairly dramatically. So the question around symptoms is a great one, and I'm going to let Leanne chime in on that, but it is a great reminder about some of the measures that we are taking to protect ourselves and that we are rapidly taking to protect ourselves as a people right now, which is the social distancing, not being in groups, large groups, washing our hands frequently, avoiding touching eyes, nose, and mouth with unwashed hands, covering mouth and nose when you sneeze, avoiding contact with people who are sick. This is why you're seeing a lot of this in the news with more well-known people who are self-quarantining, not knowing their current status. Before I let Leanne answer, I will also say that, again, there are certain elements to this disease at this time that are mysterious and unknown, which is why the House acted to pass the first package to fund some of the research to understanding what we are facing. And Leanne, or Dwayne, if either one of you, Leanne, I'll let you start, and Dwayne, if you want to fill in anything else there, please go ahead and do so.
Yes, so I'm going to turn it over to our medical director of the health division, Dr. Russell Faust, to answer that question.
Fabulous.
Thanks, Leanne. And that's a great question. The symptoms, especially in a young person, can be fairly mild. The risk for the young, 20 and below, is very, very low and increases every decade with every decade of age. And we certainly would like to keep our elderly from being exposed. And so right as of today, in fact, the CDC has issued a directive or a guidance for example, for when someone can be returned to work after being infected or being symptomatic. And their answer is, if you've been asymptomatic, that is without symptoms and without a fever and a cough, for 72 hours, and without a fever, not using ibuprofen or Tylenol, that sort of thing to bring your fever down, but 72 hours on your own, that you're good to go. You can go back to work without transmitting or being a very, very low risk of transmission to others. Studies around the world show that we can potentially shed virus for a while, but a very, very low risk of transmission. Does that answer your question?
Doctor, the caller I've stepped away from and moved forward, but it does sound like a very succinct answer. Thank you very much. Moving forward, we've got John in Rochester Hills.
Yeah.
John, you've got a question about health insurance.
Hello. Yes, I have
Hi, John.
a question. Hi, Congresswoman. Thank you for taking my call. I read the other day that Wall Street had $1.5 trillion passed on to it for something, and I'm wondering what is Congress, especially our fine Democratic representatives, doing to put together some type of comprehensive health care, whether it be Medicare for all or some type of piggyback on Obamacare. My big concern is for people without health insurance. I'm 71 years old. I've got Medicare and supplemental Blue Cross Blue Shield, but I am so worried about these people who have no insurance.
Right. And thank you so much. That is such a timely and important question, and certainly relates to, John, a lot of the work that we've been doing in Congress in this 116th session, particularly to protect and improve the Affordable Care Act and rid this nation of junk insurance plans that don't officially cover people, as well as expand affordable, accessible health care to every American. Certainly Michigan has been an incredible leader in this space, having expanded Medicaid to millions of people following from the ACA's passage. We halved our uninsured rate, although we still have about a 6% uninsured rate in this country, and too many Michiganders saddled with expensive insurance plans and prescription drug costs that are through the roof. As an aside, that is also why the House acted to pass a prescription drug relief bill that would lower the costs of medicines that are wild and exorbitant, and something that has been impacting too many Americans for too long. As it relates to the current the current who are uninsured right now, not only in Michigan but throughout this nation, part of the early Saturday morning package that the House of Representatives passed in bipartisan fashion, the Families First Act, as part of the testing that we were looking to expand, that would be free testing no matter the income status. We have been urging the current administration to create a special enrollment period for individuals who are uninsured during this time as well, which will help those who lack insurance. It's obviously unconscionable, and I have been fighting and working my entire adult life to get every American access to affordable, quality health insurance. And this certainly, as you mentioned, underscores the importance of some of the safety nets that are already in place with the Affordable Care Act and Medicaid and Medicare in particular, as well as future policy proposals that would potentially lead to a public option or guaranteeing health care for all Americans, of which I am absolutely in favor for. So we need to pass the Families First Act to immediately get everyone access to free testing. We are encouraging everyone to get tested. Dwayne, I didn't know if you wanted to chime in outside of the legislative front on anything that you're seeing on the testing front here to make sure that folks know it's accessible and affordable.
Thank you very much for the opportunity to respond. I think that testing is really a challenge right now because it's not widely available and really limited to large reference labs and larger health systems. We at University of Michigan just stood up our test today. Other institutions within the state have a couple of other institutions. I believe Henry Ford is live with their testing, and Beaumont is live or about to be live. So it's taken quite a while because the process has been very, very difficult to get through. So the challenge with that is that we have a combination of, or we have a wide variety of different types of patients with different severity of disease. And the health system health systems around the country are already seeing very, very severely ill, and we've had fatalities within the United States. And so the important part from a healthcare patient management standpoint is making sure when there's a limited resource that resource is applied in the situation where it can do the most good, especially right now. And it's challenging because the resource is limited. There's not a lot of testing capability. Over the coming weeks, we'll see that increase significantly, but we don't know what the burden of disease is going to be and how many patients are going to be infected. And the big challenge is, some of the questions, the question that was answered previously about what the symptoms were like. Most people who get infected are going to have a cold, and it's not going to be a severe disease. But some people with severe underlying diseases that cause their immune system to be not as strong are going to be more susceptible to having very severe infections and potentially fatal infections. And it's very challenging to be able to sort that out. You're not going to be able to necessarily look at a person and know what's going to happen with them. And so the idea of testing everyone is great to help understand what the epidemiology of the disease is, understanding where it is, who's getting infected, how widespread it is, how long it's been there. But it's very difficult to accomplish that when there's not a lot of testing capability around. And so we're trying very much to focus our approaches on doing the most good and providing the most important information to the people that need it, whether it's from managing patients within the health system, but also helping to support in the public health mission and take some pressure off the public health system and the testing load that they're under right now. So it's a challenging situation to try to address, but I think in the coming weeks we'll see a lot more capability from a lot more labs around the state and around the country.
Thank you. Thank you, Dr. Newton. That was incredibly helpful. And as a reminder to maybe new people who are on the call, or just those of you who might have missed it, *3 to ask a question, share a story, share a concern. We want to hear from you in this moment. We are joined by two incredible professionals in our community who are also helping us answer questions this evening. Dr. Dwayne Newton, the director of the Michigan Medicine Clinical Microbiology Laboratory, as well as Leanne Stafford, the health officer for Oakland County's Health Division, who is also here with us, Dr. Russell Faust, assisting Leanne in his capacity as medical director for the Oakland County Health Division. So again, it is *3 to ask a question. And your Congresswoman is delighted and eager and willing to take any question. And with that, why don't we move on to the next one?
All right, Congresswoman. Next up, we've got Kim, and she's got testing centers on her mind. Kim, go ahead with your question, please.
Hi. Thank you for taking my call, Congresswoman. I am a registered nurse, and I really think, and I'm glad I believe the physician already discussed the testing dilemma. However, I think we need to become creative, and I think there should be developments of satellite testing centers. I think whatever funding we get, we need to be creative, just like we have the drive-through fast food. I think we need to mimic what they did in China and South Korea, because they were, unfortunately, the testing grounds with the pandemic. We need to adopt some of the things that they've done. In other words, best practices. We need to know who has the coronavirus. I went to visit my primary care physician because about 3 weeks ago, maybe I had it. I don't know. I'm normally pretty healthy, but I do have asthma, so I have an underlying health condition. I am 61 years old, and I was so incredibly sick. I went to my local emergency room on a Tuesday. I'll never forget. Within 48 hours, I had a headache that was so severe. I called 911. Never in my life have I ever had to use emergency medical response. So they came, transported me to the hospital. They tested me for strep, the flu. They were all negative. I felt at that moment I was the perfect candidate for COVID testing. But I don't think the facility was prepared. I'm not criticizing. This is real. This is what keeps me up at night. The inability of us to test those who meet the criteria. Maybe I had it. And then my primary care physician, I had the requisite follow-up visit. I saw him. He was actually teasing me. I wore the mask. He says, oh, hurry up and leave my office before you get it. I want to see you in a week. I did have a sinus infection and a virus. He says, oh, you're really sick. Low-grade fever, all the classic symptoms. Well, his office was shut down last week because he actually was sick with the flu. The health care workers need to be tested. That should be mandatory. And those who are high risk should also be testing. We really need to come up with some type of strategy, or else it's just going to continue to proliferate. So that's my question, comment. I don't know what else to say, but thank you for having this town hall and all that you did for your constituents.
Oh, well, that's so great of you, Kim, and this is what this is about, is just sharing these ideas, sharing stories. You're not the only one. I've heard many cases. We've been very alarmed about this situation of which Dr. Newton outlined around the testing, and obviously we want to get him in on this. But those are good ideas. These are things that we need to hear people's individual experiences and kind of see how we can do a little bit better and push this back and contain, test. Dr. Newton?
Thanks.
Do we still have, okay.
That's a really great real life example of the kinds of things that we're feeling and the experiences that we could learn from. And I think that's exactly what we all are trying to do. You might see news and hear, or maybe even participate in your health system in activities related to kind of drive up or drive through specimen collection. And I think one of the important things is to remember when we see these on TV or drive by them, there's not testing that's happening there. They're actually reviewing the patient, reviewing issues with the patient and collecting the sample. And then that sample has to go to a laboratory like mine to get tested. And that takes a while because of the way that the technology works. It's several hours at this point. It's not like in the doctor's office rapid tests that you can get in 20 minutes. That's not where we are with the technology for detection of this right now. It's not to say that it couldn't be, but that's not where it is right now. And I think that as I mentioned before, the ability to do more testing coincides with the ability to do more rapid testing over the coming weeks, because the large companies that we rely on to develop these important tests that we use in our laboratories have been able to scale up production, putting a lot of research and development time into creating excellent tests that we can use. And the federal government has provided some guidelines and structure around how to ensure that those tests are performing accurately, but do that in a rapid manner that allows us to roll them out more quickly than we otherwise would. Because in a normal situation, to get a test approved for release and use in a hospital laboratory, it might take several months to a year to do all the studies, generate all the information, and submit that and have it be reviewed by the FDA. We were able to get our test up and running. And what's today is the 17th. We started on the 2nd of March. So unprecedented in my lab. It's unprecedented in my lifetime as a professional in this field that we've been able to get that kind of thing done so quickly. But we need to do things faster, and we need to be able to provide that those services more broadly to help curtail the outbreak. It's a very challenging situation, but I feel like we're making great progress, and the things that were mentioned by the caller are exactly the types of things that we're trying to accomplish.
Thank you so much. That was great. And thank you again, Kim, and we'll go on to the next question. And as a reminder, *3 to chime in here.
All right, next we're off to Troy. We've got Mark on the line and wants to talk about the unemployed during the crisis. Mark, go ahead with your question, please.
Hi, thank you very much. So I've been unemployed for 6 months and have run through my unemployment insurance and actually got a job in that just last week, and now that's been delayed to start till I don't know when because of the coronavirus. And so I'm still unemployed, but with no income. Is there anything being done for people and kind of in my situation to get back on unemployment? And also, what about any help for mortgage relief?
Yep, great questions, Mark, and thanks for chiming in on that front. What I'd love for you to do is follow up with us in my office so we can, as part of our case management, open up a case for you. We obviously don't provide the state unemployment insurance through my office, but we want to be able to assist you in navigating the extension that the governor is granting through the expanded unemployment insurance until April 14th. So we would like to help you through that process. In addition to mortgage relief, there are almost no considerations that we will not take into account in addressing the economic ramifications of this pandemic. As you've maybe heard in the news of the actions being referred to as a stimulus, I don't believe this is a stimulus, all right? I don't think we had a pretty much nice humming economy, Mark. We could have seen you. I don't know what your profession is or what you were looking to go do, but lots of jobs available, actually very low unemployment, humming auto industry, high GDP. Obviously, people who measure things by the stock market would have seen the high stock market performance. Now we are seeing history before our eyes, truly. Right, so this is now a moment in time with the largest drop in the stock market in its history, the largest drop for the airlines in their history. Those are some of the big boys, but for everyday Americans, this is the commitment. You're not going to be left behind. So there's proposals that I am delighted to see being floated through the White House. I have been in communication with the White House. Believe it or not, I actually have some relationships over there, given my work on the trade deals and my willingness to, shelve partisan antics to get things done for our region. So, we're talking about securitization, financial securitization for everyday Americans. The White House today has signaled and said through the president that they are in favor of cash assistance to individuals. This is matters of economic policy, and I don't want to be doing policy making with all of you guys on the phone, but essentially there's no way to determine who's going to be impacted here and who's not. You might be able to have your job, but your daycare has changed, and now you're working from home, or your daycare bill's gone up, or a health care bill has gone up, or one person lost a contract and now they've lost wages, and now your mortgage payment is being threatened. And so there's a reason why you're asking this. This is a reason why the role that so many of my incredible colleagues from the Bush administration, from the Obama administration, who were in the Treasury Department during the last financial crisis, are coming back together to put forward a set of solutions to address the rapidly confounding economic conundrum that we are finding ourselves in. So I'm not calling this stimulus, I'm calling this triage. And it goes like this. First, for every single individual and household and adult and child in this country, right? My office has compiled the food pantries and the food banks, with the restaurants being closed and the different things going on, that we're going to make that available. We're so proud with the schools being closed that, and look, there's no good way to talk about all that's happening, right, because it's happening so quickly. So we got schools closed, we got businesses closed, people are teleworking. I mean, this is a lot for any of us to absorb, but we are absorbing it together as a community, as a district, and we're going to get through this together, all right? So our schools are providing lunches. I know Birmingham, bravo to them. They're providing meals to any child who comes in. Pontiac has great resources. They're not even in our district, but you drive through them half the time when you're going from my neck of the woods, Auburn Hills, up to Waterford. We're in direct communication with all of our schools. We're continuing to compile those resources, so immediate assistance for people so that we don't fall off financial cliffs and start defaulting on mortgages. Very important in this situation. As we're on this Tele-Town hall, I'm getting notices from my colleagues in the Michigan delegation that some of the department stores are closing for a week or two, right? So this is an unprecedented moment for all of us, but we're going to manage it through very carefully for all of you. I got your back, and when I say that, I mean it. And I've already been working around the clock just like I did in the auto rescue days. All right, don't worry, I'm staying healthy, but I'm doing the work in coordination with the right entities to make this work for us. We already talked, obviously, about our mom and pop shops. That's another major component to this that will be quite complex, but we're going to see our small businesses through on the other side of this. We've got so many beautiful downtowns in our community, and we're not going to let those businesses go by the wayside. And certainly, we're going to make sure that our critical industries stay in put, because you don't have a country if you don't have an auto industry, if you don't have an airline industry, if you don't have energy and agriculture. And so all of that is being reconciled and considered as part of this. Obviously, consumer activity, this is just a quieting period. What we saw in China with what they went through, this was, their Lunar New Year. The country goes really quiet. This virus was spreading. They took the measures, and they basically stayed kind of like how we all are in that holiday period where we're not, we're kind of at home and things along those lines. Now, I don't want to underestimate how difficult the social distancing is. And I've been putting this out in the newsletters for all of you, and I want you, I've got to go to my Facebook. I got it on the Facebook, some things that, you can turn to. You're obviously sharing with your friends and family, but that is a real pain, all right? And we've got to recognize that it is, it's something that we can grin and bear through together. There's, activities, there's singing in our neighborhoods, there's amazing things happening, the beauty of humanity is showing. But I also want to recognize, to all of you on this line, just as I did with my own staff, some of the, emotional pain of this, being separated from loved ones, not being able to go visit mom or dad or great aunt or grandpa or grandma at the senior living center where they are. These are traumatic moments. They are moments we will carry ourselves through. This is why we have good government. This is why we have a phenomenal government. This is why we have trust in our elected leaders. I say God bless the United States of America as I say God bless to all of you, and we will continue to keep moving forward here. Next question.
Next question comes from Auburn Hills. We've got Denise with daycare facilities on her mind. Go ahead, Denise, with your question, please.
Yes, I was wanting to know why all the schools are down, but daycares are still open.
Yeah, that's a great question, Denise. And, I know that's been troubling for a lot of people. Do we still got Leanne? Leanne, are you still here? Can you just chime in? I know you probably got to get going in a couple minutes here.
Yeah, I'm actually still here. So the question about daycares is this situation is really evolving rapidly. And so we are looking at every opportunity for mitigation, what are our next steps going to be. So we're always thinking here what needs to be that next step. And so as the situation evolves, there could be changes coming or, again, we're trying to see what the situation brings in the community.
Yeah, all right. So this is sort of day by day. It's a great question, and Denise, we're going to, make note of that, and I'm going to pass that up to the elected officials that I'm, talking with and working with, particularly in our state. I'm obviously co-sponsor of legislation that's supporting students in response to the Coronavirus Act. This is new legislation that will provide $3 billion in support of child care facilities and school districts during this national emergency. I encourage everyone to continue to reach out to my office for specific inquiries about their school districts. We recognize how painful it is to have schools closed, graduation ceremonies, our K through 12, our phenomenal classrooms. I love our classrooms so much, and our, all the activities that go on in our schools, and obviously with our universities as well. Make no bones about it. This is a sea change. This is a new moment for us, and I'm going to continue to work with Michigan and our U.S. Department of Education, on the state of Michigan and the U.S. Department of Education on additional flexibilities for all students and all children and all families. So thank you, Denise. You're helping people by asking those questions.
All right, next up, Congresswoman, we've got Chris, whose wife is is a healthcare worker. Chris, go ahead with your question, please.
Hi, yes, thanks for taking my call. It's actually my wife that's a healthcare worker. She works in a hospital and describes the challenges of the workers getting the supplies they need to keep them safe. I know you talked a little bit earlier about the funding that was freed up to make available for supplies, but I just wanted to know, I guess, more specifically, what things like logistics-wise they are doing to help provide supplies like more immediately, accelerate that process to the hospitals, because I know the situation right now is not great at a lot of the hospitals around the area.
Yeah, thank you, Chris, and thank you to your wife for her efforts and professionalism and being a healthcare worker at this time. Our healthcare workers are our country's new soldiers. And this is a question that we are getting across the board. I know I'm just running up to a couple minutes with anyone else from our Oakland County. I don't know if I still got you guys. I know we're still trying to squeeze your time a little bit. But if Dwayne or Leanne want to chime in real quick, we'd be happy to have them do it, and then I can fill in a little bit more for you, Chris, you and your wife. Okay, Leanne, are you there? Okay, we might have lost our Oakland County experts given the demands that are on their time. But in short, I will say, Chris, that we are aware of some of the supply chain issues and certainly the lack of what's called the PPE for, personal protection And this is something that I know our executive office, our White House, in addition to our governor, are working on. Our governor in particular has stepped up to play an incredible leadership role in securing our supplies. And we are also working through the House Energy and Commerce Committee and the Defense Production Act to get those supplies in. So I will make note of your great points on this call. We, as members of Congress, and particularly I as your member of Congress, am working to address this at the most immediate of scales to address the needs of our and acquire the supplies of our healthcare workers.
Thank you very much, Congresswoman. We're going to move forward. We've got, let's see here, Naresh. Naresh is looking to find out how he can volunteer, it looks like. Naresh, go ahead with your question for the Congresswoman, please.
Oh, my goodness. Yes, hi, Naresh. Thank you for being on.
I have a question. While the government, medical professionals, and everyone else is trying to do what is needed in this hour of crisis, and I'm very keen to proactively do my part by serving anyone who needs anything in the community, including my time and money. I want to know in what way I can help, and where do I go to find out, this kind of work. And I'm sure there must be many, many more Americans wanting to do the same but don't know how to do.
Right, and I, look, previous to ending up in this healthcare crisis, we had been reviewing measures to help those who are retired healthcare professionals re-enter the workforce, and I know that's to be done. I would expect more to come on that, and we want to thank you so much, Naresh, for your incredible heart and willingness to serve your community at this time. Two things to consider in terms of volunteering. One is that we would like for you to refer to your city government. City governments are regularly sharing volunteer activities. I'm collecting as many of them as I can, and we're sharing them as well, but I would call your local government as well, and we can help you do that, and I'm happy to connect you to that after this call. And then on the more acute point around medical assistance, this is something that is, I expect, a matter that our governor is taking on to grow our healthcare provider network, our healthcare professional network, and ensure that we have all the resources, both in terms of human capital as well as what the phenomenal question from Chris was about, which was on medical supplies. So this is all of government. We're all working together. We appreciate citizens who are willing to stand up and help. This isn't necessarily a call to do so, because we still need to practice social distancing. We need to have our healthcare providers, and again, Chris, this is to your great question, making sure you're covered and dressed properly, your wife is, and that they have all the resources and that we have all the equipment that we need. I have been in direct communication with a lot of our hospitals on that as well. And I know I mentioned 2 points, Naresh, but if I was going to add a third, it would also be potentially reaching out, given how recently you may have retired, to your previous employer or to your hospital. But again, questions like this are going to help people. They're going to save lives. That's what's at stake right now. And I'm going to pass this along as well, and we'll continue to work with you to make sure we can get you plugged in here.
So next, Congresswoman, we've got Mark in Commerce, and it's about the stimulus packages. Go ahead, Mark. You're live with the Congresswoman. Hello, Mark. Are you there?
Oh. Star 3. Oh, shit.
Oh, my goodness. Well, we're going to move forward quickly. We got Elizabeth on the line from Birmingham. Elizabeth, you want to talk about hand sanitizer? Hello, Elizabeth. Well, occasionally this does happen. We've had these callers in queue for a little bit, Congresswoman, so I do apologize. Next up, let's try a caller out of Walled Lake looking to talk about the testing. So, Donna, are you there? Let's go ahead with your question,
Can you
please.
hear me?
Yes,
Yes.
ma'am.
Well, I've been hearing a lot about testing, but I have never heard about the procedure, exactly what they do. If it's a cheek swab or if they do a blood draw, or what exactly is the procedure?
Do we still have Dwayne? No, Dwayne had to go. Okay. Great question about the technicalities of that. It is a chemical procedure, and it is something that is medically conducted, obviously, in the hands of professionals. It's not a blood draw that we know of, but it's similar to what they do for the flu, which is a swab. There are components to it, and as Dwayne discussed earlier on in this call, we had to develop the test for it as well. So when you hear testing, we're trying to make it accessible, but it is a swab, which is also why when Kim was talking about some of the different mechanisms to get people tested. One thing you could do right now, Donna, is be taking your temperature every day. That is something that I would encourage everyone on this phone call to do as well, as if you have the ability, is just monitor your own temperature while you're social distancing and self-isolating during this pandemic period.
Great answer, Congresswoman. Next up to Livonia, we've got Roseanne. And Roseanne, you're concerned about the shortage of ICU beds, is that correct?
That's correct. Thank you for taking my call. I really appreciate the steps the governor has taken so far to slow down the spread of this disease. But I was wondering, how is Michigan preparing for the expected shortage of ICU beds and ventilators in the state?
Yeah, and I know you're asking that given potential projections and a spike in critical cases of COVID-19. And Roseanne, that is a perfectly acceptable question to ask. While we haven't received any official pronouncements from the governor, I believe that many actions will be taken to develop and procure the ICU beds that are needed to address this pandemic and the existence of COVID-19 in Michigan. And so what that's going to be is that's going to be potentially working with the U.S. military, potentially calling on hospitals or dormitories or different available and open resources to provide those beds should we get in that situation. It's important to remember we have a less than 100, less than 75 identified cases at this time. We have not had any deaths in Michigan at this time from COVID-19, although we are managing and protecting the care of all those who have been infected with COVID-19 and are working rapidly to stop its spread. And we are taking, based on projections and some of the measures that other states in our country, such as California, are taking to address the projected ICU bed shortage very, very seriously.
And our next question comes to us from Don. And Don, you're concerned about filing taxes. Go ahead with your question, sir.
Thank you for taking my call. With the next 30 days coming up, I know mitigation is going to be probably being more of a high concern, and April 15th being the filing deadline for the tax returns. What kind of actions going to be taking place for senior citizens that are trying to do self-isolation at home, going to be going out in the next 30 days to get their taxes filed?
Right. You're not the first one who's asked me this question, and we're going to have to, first of all, recognize the depth of this. And I think the point you just brought up, Don, is a good one. And recognizing how complicated it will likely be to file your taxes during this pandemic protection period that we are in, particularly in Michigan. Not every state has taken the measures that we have in this country, but many are, and many more are expected to join in adopting the protective measures that we have taken. So again, this is a great question. You're not the first person who's asked this of me today, and it is a question that I am circulating with my colleagues, particularly Congressman Dan Kildee, who represents Flint and who is the Michigan House member on the House Ways and Means Committee, which is the tax committee, and will certainly be a part of the discussion as we move forward with economic triage and assistance. As a reminder, individuals can apply for tax extensions, so I don't want to offer false promises at this time. I just want to recognize that we understand that it is a problem, and it very well likely be that individuals who are having trouble filing will be recommended to file extensions, which is perfectly legal and acceptable, and my office will, as we always have been, providing resources to the IRS to assist people with claims or tax filing issues. So know, Don, that my office is a resource, a continued resource on this. I will continue to be a resource for you, but just know that it's status quo for now on tax filing, although we are recognizing some of the issues given the response and containment strategies to COVID-19.
So as a quick reminder for everyone on the call this evening, if you have a question for Congresswoman Stevens, you can press star 3 on your telephone keypad to be placed in the question queue. Again, by pressing star 3, you can ask a question live on this call. Next up, we've got Angela, and Angela is talking about the county or state lists of exposure locations. Angela, could you ask your question, please?
Yes, I had a few questions, really quick ones. I just wanted to know, instead of relying on the media for our, exposure sites, is there anywhere we can go for the state at a county level for that information? I know they were doing it in the beginning, but I found it to be very helpful for us.
Okay, yeah, we'll pass that through. That's a great question, and I don't have the immediate answer on that, but we might have lost you, but that's we should. Are you still there? Okay, yeah. I just didn't want to totally cut you off here on that front. So you're saying when you're going online now, it's not the same.
Yeah, I mean they did it in the beginning, but you're getting it from the news sites, and I'm really leery about getting my information from the news. I would rather get it from my government, trusted sources. That was my first one, and if you have to get back to that, that's fine. And I have another quick question.
Sure.
Like beauty salons, everything else is closed, and the whole idea is for social distancing. Yet I have, a friend that has to go to work and maybe your employee doesn't enforce, doesn't feel that this is as serious as it is. And you're still having to work with people that they're allowing to come in that are ill and sick. And I just want to know, what is your protection against losing your job if you feel that you are in a position where you're being exposed to something?
Yep. Family First Act. We passed it in the wee hours of Saturday morning in the House. It's a great piece of legislation. Senators Gary Peters, our hardworking Senator Gary Peters, and Senator Debbie Stabenow are working to pass it through the Senate this week. Families First Act will guarantee paid sick leave to anyone at any company under a certain threshold. And it really is there to provide that backstop for people with this concern. And I'll tell you, a lot of the salons are closing. And this is part of this conundrum with our small businesses, right? Because how long are we going to contain the virus? How long does this get contained for, right? And how long are we in this social distancing, self-isolating period as a state? And I'm going to tell you the answer to that question. We don't officially know. We know how long the schools are closed for. We know how long the restaurants have been asked to be closed for. We know how long the governor has required social distancing. We have seen some beauty salons take measures of being closed for the week, and people who are able to, unlike your friend, remove themselves from the job at this time, which is obviously painful for all these individuals who love what they do. You know, we love what we do. We love going into work. That's why people do those jobs, and they provide such a gift to their clients in the process of doing so. And so this is a part of the broader economic policy conversation that I am taking an active and leading role on behalf of this district and on behalf of you and your family and your friends. And so once we get paid sick leave, and I'll tell you this right now, you know, it's uncomfortable right now, but, you know, the health comes first. The health is first. This is what we are. This is the actions that we are taking as a nation, and so, and certainly as a state. So we're going to get that done for your friend, and we're going to, and for anybody who wants to access the paid sick leave, because we certainly don't want anyone being exposed. And I do believe that more businesses are going to be following suit. More employers. I know people have mentioned, in addition to these salons, some of the daycare centers that are remaining open. And no one, you know, we are, as we all know, you know, our president is a believer in business. Our governor is a believer in our economy, and the right for every individual to live a free and happy and healthy life and access all the economic potential that they can. We are in a unique and unprecedented moment and time. We are in a what has been declared as a pandemic, and it is a battle of sorts. And this is a battle, in my opinion, that everyone in Michigan is uniquely prepared to fight and win together. And that's what we're up against. Does it help your friend day to day? We're keeping to working on that. I'm going to encourage you, Angela, have her call the office. We'll open up a case. We're on full mode here. We're social distancing and teleworking, but all my caseworkers and everyone is hard at work for everyone in this district to make sure they get what they need during this trying time. Thank you.
All right, out to Plymouth we go. We've got Carolyn talking about mental health care. Go ahead, Carolyn,
Hello.
with your question or comment.
Hi, this is Carolyn. Medicare and Medicaid have approved Skyping and teledoc programs to address medical needs and for social distancing. My question is, can mental health providers provide the same remote access services? Because my understanding is they currently are not being paid to provide that. And I know the Michigan VA has approved remote counseling for veterans, and 2 thumbs up to them. That's my question.
Yep. Well, Carolyn, thank you. The VA is doing telephone appointments. The governor has expanded telemedicine for Medicaid beneficiaries, and so that anyone can receive care in their homes. And there are talks right now of expanding that at the state and federal level, including to Medicare beneficiaries. So keep questions like this coming. We can do casework and open up a case on this matter to continue to address this. And Medicaid is covering some of the the therapy needs at a social distance or through this telephone process that I know are so important and essential to everyone. So again, commitment to everyone on this call. Please open up a case with my office if you are not getting what you need on any of these fronts, and we will help you to the best of our ability.
Next up, we've got Melissa in Plymouth. Melissa, go ahead. You are live with Congressman Stevens.
So my question is around ventilators. So I understand, and the statistics have been given that there are 160,000 ventilators in the U.S., which is less than 5% of our population. And if you look at the statistics of who is most vulnerable, which is over 25%, my question is, why can't we mobilize some of our manufacturing facilities, especially if they are observing social distancing, to work in the manufacturing facilities for ventilators and such?
Amen. I love it. It's certainly a call to charge that we in Michigan, given the critical role that we played in World War II, could pursue. So I love that. I think that's great. I'd like to push for it. We need to increase the number of ventilators. The governor is very keen to this. We are orienting. The president today encouraged the governors to act individually and pursue these activities, and so we are doing that. I previously mentioned, Melissa, this point about the Defense Production Act, which could be also used in this way to meet some of the needs. We obviously know we, based on projections, don't have the number of ventilators we would expect to need. So we're going to be taking vast and rapid action, and I would imagine something along your brilliant suggestion would be among them. Thank you. You're fabulous.
So, Congresswoman, we have Rick next from Livonia and wants to know about insurance covering treatments. Go ahead, Rick, with your question.
Hi, good evening. First of all, thank you for arranging this, Congresswoman Stevens. Appreciate it. I have three separate, distinct questions. Are only yes/no answers. First is regarding the testing. You've mentioned that the bill would include coverage for testing. Does that also include coverage for treatment, like medical transport, overnight stays, any medical procedure implemented at the hospital? The second question is, NIH announced yesterday that it's starting human clinical trials for vaccines. Are we in contact with the healthcare officials out there? And then lastly, the third question is, you've mentioned several times throughout the call your commitment to good health and well-being for every and all American. I'm wondering if that commitment also includes supporting a Medicare for All bill. And yeah, those are my three questions.
Yeah, well, thank you. Certainly all options are on the table as we work to address this. As I want everyone to have health care coverage, okay? I don't know where this conversation has gotten with, I'm a Democrat, okay? I mean, I want everyone to have health care coverage. We have we've got some proposals. One, the Medicare for America option, which would guarantee Medicare for anyone who would want to access it of any age. That's certainly something to explore. I've certainly supported lowering the Medicare age buy-in, which is very important. But the reality with a drastic move like Medicare for All right now actually kind of concerns me because we've got 180 million people on private health insurance. I know not all of them love it, but I don't want to be rocking the boat right now with removing everybody with their private health insurance. Do we need to make improvements to that system? Absolutely. Am I committed to that through the long run? Absolutely. Right now, we got to make sure that everyone gets covered, okay? So that is, we know what to do on that. We've got to expand and improve the ACA. We've got to pass public option bills, and part of this legislation that is being passed in bipartisan action right now is taking some of the early steps to make sure as we combat COVID-19 that everyone has that. So I'm not really sure if that question was insinuating that I am not for the full health care coverage of all Americans, because I absolutely am, but I am a Democrat, and I am not in the business of taking anyone's health care away, particularly in the middle of a pandemic. So let's all just be clear on that. On some of your other points, Rick, and thank you for dialing in from Livonia, and for doing this and having the courage to ask some good questions. I'm working to make sure that there is minimal cost sharing for patients, especially for testing and the additional services that come with that, as well as continuing to coordinate with all of the providers in this spectrum. Thank you so much for weighing in. I know we got a lot of questions, so we'll keep going. If we miss anything, Rick, you just ping us a note and we'll get back to you.
All right, next we've got Spencer in South Lyon. And Spencer, got a concern about your daughter's work environment or her work being canceled? Go ahead, sir, with your question, please.
Yeah, thank you. Hi, Congresswoman, and thank you very much for taking the call. The call relates to, I guess, what the media is now calling gig workers. My daughter's an entertainer. She sings for a living. She has a band.
Bless her heart. We love her. We love our singers.
Pretty good too. They usually run anywhere from like $4,000 to $6,000 a month in revenue from mainly from doing like corporate events or larger weddings. So at this point, for the rest of this month and looking into next month, all of those types of events that she had on her calendar have been canceled. So we're now sitting at March 17th. Come the 1st of April, she's not going to have her rent money. Her rent money is about $2,000. So my question is, how much and how fast will the government be able to provide financial assistance to people who are not able to work, and how do they go about getting this money?
Yeah, no, thank you. And tell your daughter I want to see her sing. I want to see the band and our entertainers, which sometimes people just kind of take for granted the entertainment culture, particularly that we have all around us, not only just throughout broader America, but right here in Motown, right? And, just the other week I was at Troy High School with the fabulous orchestra, and you're thinking, holy smokes, they're not doing their performances. Now, your daughter's a grown adult, and she's making a great living with her bandmates off of this, and guess what? Yeah, everything's dried up, and it's looking kind of bleak. And so we, as I have talked about some of our impacted taxpayers, our impacted community members, people like your daughter, and as you smartly mentioned, Spencer, the gig workers, right? The gig workers of our great country and society here in Michigan. We're not leaving them out. Okay, and they can't be. I mean, this is not like, hey, your entire ability to make a profit has gone by the wayside. Good luck, right? No. So we're including all of them as well in the financial triage, right? This is this financial triage that I'm pushing for as your member of Congress, which is going to include a multitude of things. Certainly refundable tax credits for the self-employed. That's, down the road, but it's helpful. That was already put in the Families First Act, and for sick and family members who are, on the medical leave, that's a part of it. But Package 3, Package 3, guys, it's coming, and it's got to come quick. It's a roaring train here. This is why you're Congresswoman. If you were my neighbor, you would see my light on, because I am working late on this, and we are working on a big package right now to address the immediate financial needs of impacted Americans across the board, in cooperation with some of them with direct employers. Obviously, that's important because the small businesses need to be secured, but our fabulous example with Spencer's daughter, our gig workers, we got to make sure that she has access to cash And I'm out there talking about it already. I'm all for it. So is the president. So is Mitt Romney. So are Democratic members. This is an all hands on deck. Immediate cash relief now for people. So I want to make sure by the time your daughter gets her next rent check due, that she's got, her rent payment due, she's got the money to make it, right? That is what, all the bills, all the things that come into play here. I mean, people have their whole lives oriented, and guess what? There isn't pandemic insurance. There isn't insurance available for this. There's no guarantee. But what there is the beautiful United States of America, the ability of our government to come together in a cross-functional and cohesive way, just like I saw with my very own eyes in another time of economic crisis when our auto industry was staring off the ledge of the cliff's edge, potentially going to go bankrupt, right? We said, no, we're not going to let you go bankrupt, not just to the companies, but for the workers. It was the Main Street effort. People kept their jobs. We saved millions of jobs across this country. Today, a new story, but the same tune that we are singing and the same commitment that I made to you 12 years ago, I make again to you today, which is that no one will fall off a financial cliff if I have anything to do with it. And I got a voting card. I'm one of 435 members, and I am racing to get back to Washington in a healthy and safe and secure and protected way to place that vote, to help your daughter, to help people who are suffering through this uncertainty and this downturn of which we hope will be over soon, but cannot be over until the health of this country is secure. And that's why we've taken rapid action to do so, quick self-isolation measures and the like, so that we can get back to the brilliant and beautiful society that we have prospered, loved, and lived within for so many decades and years. Thank you.
Next, we have Nicole from Clawson. And Nicole wants to talk about the SBA and loans. Go ahead, Nicole. You're live on the call.
Hi, Congresswoman. I first of all want to thank you and all of the local representatives and the Oakland County Health Department. This is a very scary time for my husband and I. We've owned and operated a small fine dining establishment for 12 years, and never did we ever imagine we would own a restaurant during a pandemic.
Right.
And there's been such clear communication from the health department on what we need to do to keep our community safe. And of course, you and many others fighting for loans because, we're not getting paid. My employees aren't getting paid if we're not in business. So we feel very, it's a very scary time, but we feel comforted knowing there's so many people fighting for us. And my question is, do you know if there will be a limit to the number of loans? Obviously, so many businesses will be applying. Will there be a limit to how many loans will be issued if it goes through?
Yeah, it's up to $2 million. And look, I just got to be the straight and narrow with you, Nicole. First of all, thank you for being an incredible business owner. Where's your restaurant?
I'm sorry, Congresswoman.
Oh, did we lose her?
Moving forward, okay. Yes.
Yeah, okay. Well, we're going to, we want to know more about the restaurant, where the restaurant is. But, thank you. Look, you've done nothing wrong. You and your husband have been incredible business owners for all the years you've been one, and I know that, all right? Now, the Small Business Administration loan program is just not going to be enough, okay? Now, you're going to apply for it. I want everyone to apply for it, but everyone's going to have to apply for it. And so the reason why you're asking that question is you're like, well, how much is actually in there? And this is why we've got to do, I believe, that economic triage. Now, to be more hopeful to you, there's no limit. So they're not going to say, oh, only 5 companies get this. No, this is actually a solid, nice revolving loan program, and there's currently up to $7 billion available for small business loans once Michigan's businesses start applying, and we're pushing. It's on the governor's desk, the qualifying application. I called the SBA on Friday and Saturday. I've been just even the helpline, because I want to know what you're going through when you're calling. And so we'll walk you through. My office will get you all set up, the Small Business Development Administration. We'll get you guys what you need on that. So there's really no limit. Right now it's up to $7 billion, which is quite sizable. We obviously projecting nationally those figures to be higher. So we're going to keep working, but this is a nice phase one for us.
Next up, Congresswoman, we've got Deborah, and concerned about food programs. Deborah, go right ahead with your question, please. Hello, Deborah. Are you still with us? Like we might have lost Deborah.
All right. Well, Deborah, can ask a question anytime, through our office line, and calling us here in Livonia, 734-853-3040 is our office line. That is I'm still taking calls. Our Congresswoman's office is still open, so anyone who doesn't get anything tonight, you can fill out forms. We'll go on to the next question, but anyone who didn't get anything answered tonight, we'll keep it going here.
Next up, we've got Delia in Plymouth. Delia, go ahead with your question, please.
Hi, Congresswoman Stevens. Thank you so much for taking my call.
Oh, good. I'm so glad to have you. Thank you. What a beautiful name.
You're so sweet to say that. So I have a couple of quick comments just to share, because I heard other stuff, and I thought I might be useful just for a couple of things.
Oh, great.
And that is the FHFA Director, Mark Calabria, on March 13th, said that there should be offers of forbearance for people who are likely to fall behind on their mortgage payments, and that should either reduce or suspend mortgage payments for up to 6 months. And that includes Fannie Mae and Freddie Mac. So that might help people to call and start talking to their mortgage lenders about forbearance. If that's something of interest. And the other thing was, I heard that gentleman who asked a little bit ago about the tests and what happens to people who don't have insurance right now. And you guys gave some great, you gave tons of information. But the one thing I don't think that you guys touched on was the fact that the CDC director last week said before Congress that he pledged that the testing for COVID-19 would be free, and the health care for COVID-19 would be free. And so that's really important. I hope that's followed through on. He has the authority to do that, and supposedly he did.
Right.
And then my concern was I have two. One is I'm hoping that, because it's like this huge glaring problem, I'm hoping you guys can find a way to insist that if you're going to allow fast food restaurants and even closed-in restaurants that are taking out carry-out to operate, that the young people and the staff working there have to be given gloves and have to be made to use them, because of, no one's talking about this, but of all the people in the food chain, they're touching pieces of paper that everyone has sweated on, coughed on, sneezed on, and God knows what in every transaction all day long, and then going home to their family. And they're not wearing gloves. And if a fast food place is going to stay open, or a restaurant is going to stay open, they have to provide their employees with gloves. It's just not okay that they don't, and that you've got people who are, even older people you see working at these fast food places, 50, 60 years old, passing out things out the window and people handing them their little crumbled up $10 bill. So it's not safe. It's just not safe.
Yeah.
That's my comment. And
Thank you.
Yep. My question is, in Macomb, Oakland, and all around here, we've got a lot of motels, where we all know that the homeless, the people who are on the very bottom of the rung, just hanging on, a lot of times live from week to week. They're not like a daily person. They actually live in these motel rooms, trying to get out of there, but just hanging on. And a lot of these people now are going to be put out onto the street because there's no protections for people in a motel, even if they're week to week. And I'm wondering if you guys, I know you probably don't have the answer right offhand, but if you could put your have your staff and your, put their thinking caps on and maybe think up something for them, because it's heartbreaking.
Yeah. No, thank you. And we know, and we will not forget the homeless, and we know how vulnerable they are. And we are seeing some of the areas in this country where there are many, and it's just a very important consideration. And I want to thank you for your heart and compassion, and you're sticking with us tonight on this Tele-Town Hall, Delia, and know that my lines, as I've been saying all night tonight, and my office is going to be open to you during this time, and we're so lucky to have people like you with compassion and heart and willingness to share everything you just did.
Next up, Congresswoman, we have a call out of Milford, and it's Robert to talk about, I guess, maybe one would say politics as usual, question mark. What's your question, Robert?
Yes, as a comment to what Kim said about testing, the CDC suggests that people should not go to hospitals for testing. It could infect patients. So there's a movement of people with personal campers to use campers as remote testing sites. It's kind of a grassroots effort, like the small boats that rescued soldiers from France in World War II. Then also about the stimulus package. Will Congress reject a stimulus package that gives any money to the wealthy?
Yeah, thank you, Robert. Both of these are great points. We can't be thinking in these terms, okay? This is not about who's wealthy and who's not and stuff like this, okay? I'm not rushing to give Bill Gates money or bail him out. We know he's got enough. And so, that's a really great question. The problem is when you're doing mega financial policy like this, and you can ask any economist, you can ask any Democrat, you can ask any Republican, unless they're trying to swindle you on something, it's very hard to meter it. Now, obviously, we're going to have income thresholds. We're not sending out cash assistance to, the gajillionaires of this country, right? But, you want to be as clean and as effective as possible, because remember what Spencer shared, right? How do I find Spencer's daughter in this economy, right? She doesn't have a direct employer, right? But she's a tax filer. And so we got to help people like her. We got to help people who are seeing contracts dried up or completely out of work and stuff like that. But it's a good question. Just bear with us here, because no one's looking to, obviously, make the rich richer here. We're the Treasury Secretary, as we were all talking, is projecting 20% unemployment. Okay, I mean, this is just an unprecedented moment for us, and it's a change. It's a temporary situation. The effects of this COVID-19 are still quite precarious. I love what you're talking about with the campers. I think we're going to continue to see these feel-good stories all over. And also, Robert, just because you asked too, and you have every right to ask that, by the way. So I'm not pinging you on it. I just want to make sure you know we're talking about securing the underbelly of our entire country right now, and so I don't want to have anybody fall off a cliff. That is my number one responsibility. That is my governing mantra, and that is going to be my commitment to everybody throughout this process. And certainly, we do have to guard against some of the protections that we've seen pass in sweeping fashion. Right before I was in Congress, the previous session, I hadn't been elected yet, they went real deep, and they, did this kind of wild tax bill. I mean, people wanted to lower the corporate tax rate. They went way far on it. We got lots of corporations that aren't even paying any taxes. It was kind of like it wasn't kind of, it was a big giveaway to the wealthiest in this country. So I can see why you're asking that, and I'm very sensitive to that, and I will make sure that this does not happen in this circumstance. And I know we had to probably move on, but I wish we could keep talking because you made such great points, and I'm really glad you were on tonight.
Congresswoman, next up we've got Emily, who works in Rochester Hills, and she wants to talk about lockdowns. Emily, go ahead with your question for the Congresswoman.
Hi, Congresswoman. Thank you so much for taking my call.
Oh, my gosh. I'm so glad you're on. Hi, Emily. We love Rochester Hills.
Thank you. Thank you. Yeah, the reason for my call is because I wanted to ask you if you have any insight into whether or not we are on the precipice of the potential for a lockdown, similar to what we've been seeing in San Francisco and elsewhere. And if that is something that's in our future, I'm interested in hearing what your ideas are on what that could look like for us, as far as what sorts of freedoms we will still have to move and kind of be, even if we are still social distancing.
Yeah. We obviously are maintaining, a healthy supply of medications and food and other essentials, and we've got to kind of continue to take this matter as we have been taking it day by day and moment by moment with trust in the foundations of our society and our government. As we know, we've really seen some great actions all across the board. And I know why you're asking that, because you're seeing this happening in other communities and other cities throughout the country, and some of them are larger and have a kind of a different geographical makeup. So I can't make any commitment to you about that right now. You are the second or third person just in the last couple of hours who's asked me about this, so I'm going to make sure that the governor knows that people are asking about this, because I'm also taking her executive orders too, and not always in the a decision-making room when they're getting made as just a colleague and member of Congress. So thank you for bearing with us here tonight, Emily, and chiming in and being such a wonderful part of our community during this incredible and important time.
Congresswoman Stevens, I'm just being told that we need to bring this call to a conclusion. So the question I have for you is, do you have any closing remarks?
Oh, well, I know we covered so much tonight, and I know this is a different format than I would have liked. I like being with all of you, and I'm glad to be with you over the phone and be with your families at this time and be connected. We're going to continue to do Tele-Town halls. I'll be doing these regularly for all of you during this time. For some of the technology that we contract with, this works very well for us. I know some of you we live stream and you can listen in on your computer as well, but we'd like to see visuals. We like to see each other's faces. So we're, obviously it's not hard to get access to the visuals for these town halls and these formats that we're going to be communicating on. And I just want to say this. Thank you all so much for your incredible and informative questions. I say they are informative because it is very near and dear to me to hear what is on your minds and the ideas that you have, the questions that you have. Just as I said at the beginning of this Tele-Town hall, those are so important because they will impact and influence the legislation, the policy making, the outreach that I'm doing to all branches of government. I have worked with all branches of our government before in my time in the White House as a White House appointee, and I'm going to continue to do that now in this capacity. I want to remind everyone to breathe, to take this time to clean out a closet. I know that sounds hokey, but you got to take your mind off things. Don't get possessed with watching the news. If you have time, call a loved one, call some old friends. Tell funny stories about what it's like having your kids at home. I know so many of our parents are adjusting to that new normal, and I know that's just a different and uniqueness to this moment. But these are the stories, and I want you all to know this. That these are the stories that will now be passed on to the generations to come. See, we are a product of the narratives that come before us, the stories of our parents and our parents' parents and their parents' parents. And part of why this feels so foreign is because it hasn't been part of recent social narrative in such a way. And now we will have new stories to share and new moments to come out of the moment that we find ourselves in now. America is no stranger to rising to the greatness of any challenge and the ability to make problems right, and that is what we are doing as Michiganders and as a community, and that is certainly what I am dedicated to achieving for you all every single day. So Godspeed. We will continue to be in touch. I want to continue to hear and talk with all of you. Office line remains open, 734-853-3040. I've got an online forum where I'm continuing to collect your questions, your concerns, your narratives of the moment. And my God, I will promise you that I will do everything in my power to make this right for us. Thank you.
For everyone on the call, thank you for joining us this evening for this telephone town hall with Congresswoman Haley Stevens. Now, to contact the Congresswoman's office, please call 202-225-8171. And to share your thoughts and priorities with the Congresswoman, please take the quick web survey at stevens.house.gov/survey. Thank you again for participating in the call tonight, and please have a pleasant evening.